Good morning, doctor.
Good morning.
Welcome to this interview. Dr. Gopal Jawade is a renowned cardiologist of Parbani City. He has more than 4 decades of experience. I know Dr. Gopal last 25 years. He might not be knowing. When out the university, some experts used to come. They had some issues with BP. I used to take them. And he used to treat and never used to charge them. That also he might not be remembering that. But whatever the experience I have while interacting with Dr. Gopal, I can just brief his personality as his spelling Gopal. G stands for his very genuine personality and very generous in dealing with patients. O stands for his open mindedness and his outstanding professional services. P is very passionate and proficient in performing his duties as a doctor. A, he's an active listener. For a doctor, being an active listener is so important because 50% of the work is done in understanding the patient. Whatever the number of patients they are, whether they are poor or rich or professionals, non professionals, I always notice that Dr. Gopal always is an active listener and he is very authentic in his approach. In Gopal's spelling, L stands for his a learned personality and he is very loyal to his duties as a doctor and as a father and husband. To put it in a nutshell about his family, Dr. Charushila Jawade she's a Ayurvedic doctor and very committed yoga practitioner. She offers lots of courses free and with minimum nominal charges for the women and men to improve their health. Dr. Jawade couple are blessed with a daughter and son. Both are very studious students. If we know about their degrees, one gets to know about what type of commitment and devotion they have for studies. Daughter has completed MBBS, MD, and DEM in cardiology, whereas son has completed MBBS, MD, and DM in super specialization, that is a medical oncology. Doctor, I'm very eager to know about you, about your childhood,
Yeah.
what type of child you were. Just can you brief us about your family?
Yeah.
What were your parents?
I'm from Manwar, that is from Parbhani district only, and my 10th standard education I have done at Manwar,
And
and
was it in English medium or Marathi
it
medium?
was a Marathi medium.
Marathi medium
Yeah,
till 10th standard.
till 10th. When we start schooling,
Yeah.
that type of school, it was a very primitive school. Only one teacher was there, and he was a very strict teacher.
Till 10th
Uh,
standard.
till it was
Okay, for
third standard.
you
Third
mean to
standard.
say till 10th
Yeah,
standard.
third. Then after third, I went to government Kendriya Prashala.
Okay.
So that government school was there. So till fifth standard, I learned in that government school. Then I got shifted to Netaji Subhash Vidyalaya. That is a private school, and it was just
Upcoming.
upcoming and very good institute.
In
So
Manvat itself.
Manwat itself. So up to 10th, I was
At Manvat.
yeah, at Manwat.
And junior
After
college?
10th, as I was a merit student, I got 13th rank in my 10th standard from
Marathwada
Marathwada
region.
region. So that time they used to pick up 30 rank students.
Okay.
So I was 13th, one thing.
Yeah.
So
So easy for
then,
you to get admission
yeah.
of your.
So I went to Aurangabad, and I have got admission in government hostel, that is Sant Tukaram hostel, and I took admission in Saraswati
Bhuvan.
Bhuvan Mahavidyalaya at Aurangabad. So I did my 11th and 12th in SB college, and I got admission in Medical College Aurangabad.
Okay, this you said they take first 30 students
Yeah,
on merit.
yeah.
Was it free education for 30?
Not like that, but they used to pick up that first 30 ranks.
For
So they used to give rank to that.
What?
Merit scholarship was there.
Okay, scholarship for the
Merit
scholarship. How
Yeah.
much it was those days?
It was in those days only 50 rupees
Yeah.
per month, so
Yeah.
hardly 600 rupees in a year.
When we
Merit.
were in 10th standard, me and Ramana ma'am, we topped the
Yes.
merit list, we got 100 rupees.
Okay.
And for 100 rupees, the teachers did not give the cash, they gave the golden ring.
Okay.
It was 110 rupees. Even
Yes.
now also I have that. So they asked you get 10 rupees and take this golden ring.
Okay.
So that had a lot
But
of value.
yeah, that was there, and my family background was quite poor. My father was serving in a cloth shop. So since his childhood, in those days, initial 5 years, we have to do free work.
Okay.
So he has started his service in that private cloth shop as a
Shops I
free.
never knew, but educational institutions they ask, sometimes private people, the teachers have to
No,
work, then
uh,
they are made as permanent. But this is so much injustice in a shop, free service,
yeah,
like
they used
apprenticeship.
to they used to call it as a shagir.
That's
So
what like apprenticeship.
for
Okay.
5 years,
My goodness.
they have to work free
Then how did
and
he
take
take care of the
experience.
family?
No, that was at the age of maybe around 13 or 14
Before marriage.
before marriage.
Okay, good.
So for 5 years means
Yeah.
17, 18
Yes,
years.
yes.
Till that age, they are not earning anything, and then they start some salary.
Yes, yes.
And probably my father got married at a very
Yeah,
small
those
age,
days, 17, 18 is.
and our family was we are seven brothers
Yeah.
and two sisters.
So, what is
So
your
I
order?
am the elder son, and afterwards, I have got six brothers. They are smaller than me, and one sister is elder than me, and one sister is younger.
So, seeing you, whether other siblings got motivated to study well?
Definitely, but everybody has taken their own decision. Like next, my younger brother, he took decision in 10th standard only. He has not opted to go for 11th and 12th.
Mm-hmm.
He took admission in Polytechnic College.
Okay.
So after 10th,
But they were interested in education, but the
yeah,
choice was
definitely.
there. Theirs.
Choice was their own.
Yeah.
So only in 3 years span he has completed polytechnic, and he opted to go in a government service job.
Very good.
But my education, like I have completed 11th, 12th, then I got admission in medical college. After admission in for MBBS, we have to go for post graduation, MD medicine, and that is for 3 years after completing internship. And after completing that MD medicine, I went to Mumbai. Actually, I was supposed to give entrance examination for DM, but unfortunately, that examination was not declared for about 1.5 years. So I took experience in Hinduja Hospital
It's
in
my favorite
cardiology field.
hospital.
Yeah,
First
cardiology.
test tube baby of India.
Yeah,
I
yeah.
was born in
Acha.
Hinduja Hospital. That's
Okay.
why in that contest only I know.
Yeah, yeah.
Otherwise, I'm not a doctor.
Indira Hinduja.
Yes,
Yeah, she was there.
I read so much about her.
Correct.
I resemble also a little bit her
Yeah,
at,
acha.
at her teachers.
So I took
Who
experience
were,
in
yeah, yeah, please.
I took experience in cardiology field, intensive care. I have worked with Dr. K.G. Nair, Dr. Anil Sharma, Dr. Tulpure, Dr. Dev Pailajani. I used to go to his private clinic also, Dr. Pailajani, for more than 1.5 years, and then we took decision to come in practice. So
What motivated you to become a doctor? Seeing the
actually,
economic condition, did you feel that at least I can support like an elder brother, I can earn better?
that time
Or it was a prestigious job,
earning
otherwise to
was
get a
not a
social status to the family?
no. Actually, all these things were not in the
Mind of
mind of
that time,
that
doctor,
time.
yeah.
All the students only they were knowing rank students, or very studious students, they will go for either medical
Or
or
engineering.
engineering.
These two
Only
options.
two options they were knowing, and probably in our school, whatever teachers they were there, whatever senior students,
So all went to
all
the.
they went to either engineering or medical.
But why did you opt for medical?
Uh, Actually, I was supposed to go for engineering. I
Uh-huh.
got admission in chemical engineering,
Okay.
but my father was inclined towards medical field. So he said, doctor is always better.
So that you can practice wherever you want.
Yeah, yeah,
Mhm. You'll be.
and doctor was having a very good
Yes, that's what I said.
social
Social
image.
status.
Yeah, social
Status
status.
was respect in
Yeah,
the society. Even today,
yeah,
after collectors, anybody is respected is
doctor.
doctors. Then others stop.
So actually, then I cancelled that idea to go for chemical engineering, and it was in Mumbai.
Mm-hmm.
So going to Mumbai from place like Manwat was again difficult thinking for my father.
Parents to
Yeah,
send that far away.
and actually my father he was hardly he learned up to fourth standard,
Mm-hmm.
but he was very good in mathematics, and he was doing
Because
job in
working
a
in the shop, you
yeah
always,
cloth shop.
mathematical
Yeah,
skills are
yeah, yeah.
very high.
So all that keeping diary
Accounts.
and accounts, and going to chartered accountant, and maintaining tax, and whatever those
Yes, yes,
records,
yes.
he was very keen, and he was a good mathematician. So, and he was a good person who was having practical knowledge.
Yes.
So probably that might be the thing which came to me also. And as a practical thing, Aurangabad is quite better place nearby to
Yes, yes.
our Manvat. So he insisted me I should take admission in medical field. So I got admitted in Medical College Aurangabad.
So after doing specialization in cardiology, did you go
Actually,
work in any institution?
yeah, actually, I have done my MD medicine. What happened? I have completed my MBBS and I was doing internship. So that is 1 year internship, rural and urban area. So I was doing my rural internship at Paitan, and that time my father was sick, and that sickness was there for hardly 2 3 months. I took him to medical college. I have done some investigations and he took treatment, but unfortunately he has developed sudden cardiac arrest. He died of sudden cardiac arrest, heart attack. So just my internship I was completing, and then that was a big problem because I was the elder
Sure.
son. My another brother, younger brother, after completing his polytechnic,
Even
he
engineering.
got service. He got service in Panchayat Samiti Patri. So in front of my father, he opted to take that government job. So we have decided in our family, because definitely I was getting admission in post graduation at Government Medical College Aurangabad. That time stipend was hardly 1200 rupees per month. So I said my 1200 rupees and my younger brother who got job in Panchayat Samiti Patri. So whatever salary we will get, remuneration we will get, uh, definitely we can go through all the hurdles, and we will survive. Our family will do well in that amount. So I took decision to go for post graduation at Medical College Aurangabad. In spite of I lost my father during last days of my internship. So I completed my MD medicine in 3 years time. So gradually my salary stipend was 1200, then 1500, and at the end it was 1800. After doing post graduation, I went to Hinduja Hospital because that was a trend in those days. Going to Mumbai, taking some experience in
Yes.
big corporate hospital. And then plan was to give entrance examination for super specialty. As my father passed away suddenly, he died of cardiac arrest, heart attack. So that was my that has become my passion. That I got interest in cardiology field. I said I will definitely practice in cardiology area. My MD medicine was general medicine, but super specialty in cardiology was my passion. I went to Hinduja with that interest only. I have worked in intensive cardiac care unit as well as I have worked with cardiology department as a resident doctor. And but unfortunately, that DM entrance examination was after 1.5 years declared. So without giving that examination, I decided to come back to my own native district. By that time, I got married also. Uh, so we have taken decision to come in our own district place. I have tried initially for getting attachment to government hospital, but maybe
Yeah.
unfortunately I didn't get that.
Destiny. You have
Yeah,
to serve many people
yeah,
in
yeah.
Parvati.
So I have started my own private small hospital. It was just a three-bedded intensive care unit. My relative was there at near bus stand. He was having a very good place. So it was a small place
Where in Parvati or
in
Manvi?
Parvani. In Parvani. So as a district place, because Manvat was a small place
Yes,
to
yes,
get settled
yes.
after doing post graduation, and even at Parvani, hardly few postgraduate doctors were there.
Yes,
So I decided to come at a district place. Started my practice in Parvani. In the beginning, what we think like when we start our practice, we think that even to get monthly income as a medical officer will get salary. So that much amount if we get, we are happy.
more than
It is more than enough. So in the beginning, when I started my practice, actually I got that much amount in
that
first
much
month,
or more than the
more than that
more than
in
the
another
doctors.
6 months.
Okay.
So I was happy.
Yes.
Started my practice very well.
What kind of challenges in the patients, like how the health profile of patients changed?
Actually, when
Now,
I came to Parvani, intensive care units and like what we used to call in those days intensive cardiac care unit. So that was very primitive. Whosoever my senior doctors were there, they were practicing medicine postgraduate doctor like, and they were having cardiac care units, but like having cardiac monitoring, having oxygen therapy, having then defibrillator in their ICU. Whenever patient gets cardiac arrest, we should have defibrillator. So all those services they are available in civil hospital and very few hospitals in Parvani. So in the beginning, I have got that idea, like real intensive care for critically ill patients. That too, a cardiac patient who gets sudden cardiac arrest and they develop complications after having heart attack. So treatment for those people in proper intensive care unit was a challenge. So, in a very small setup, I have developed that sort of facility, and then I have taken meeting also with so many senior doctors in Parvani, and initially I thought I have put an idea of having a big setup intensive care unit where four
multi-special.
five doctors they come together and they will do round the clock duties, and anesthetist will get attached. Some MBBS doctors they will do residentship in that intensive care unit, and proper ICU I have tried to develop. So that sort of idea we have collectively decided, and gradually, whatever hurdles were there in taking care of critically ill cardiac patients, we sorted out one by one.
But you started.
Yeah, I have started intensive care unit, small ICU. And then after 4 years of my private practice near that bus stand area in a rented place, I got shifted in my own setup in Vishnu. So there I have developed cardiac ICU where practical experience
Yes, yes.
and having done work in the beginning when we never used to get thrombolytic injections also properly. So in the beginning when I started my practice, hardly we used to get streptokinase. That was a thrombolytic agent for treating heart attack. So after that, we have got in our drug therapy like tenecteplase. So we have seen very beginning period or in very initial period of treating patients with those kind of new agents. Then started interventional field. So regarding that also, when I was to work in Hinduja Hospital, Dr. Matthews was an interventional cardiologist. He used to come up every 15th day in Hinduja Hospital, and he used to do coronary angiographies and angioplasty. And very initial period, that was a bare metal stent they used to put in the coronary artery. But then later on, stents they are reformed, and we are having drug-eluting stents afterwards. So I have seen that period of development of thrombolytic therapy, development of interventions, initial bare metal stent, now drug-eluting stents. So having that experience has definitely helped in treating my patient. Exactly what is the need of patient, and accordingly we should definitely modify our plan of treatment. Maybe we can say whatever best possible treatment we can give, we should advise accordingly. It was a challenge to shift a patient of heart attack from Parvani to Aurangabad for intervention. And then in that period, definitely then I thought having that cardiac cath lab facility properly
In
in your
Parvati.
hospital, Parvani, is definitely beneficial. We need not shift that kind of critically ill, serious patient to other place. So that is how reforms were there, and that is how we have to develop our
Clinic.
practice. Yeah.
My question is, when I came to Permanent in 1981, the number of hospitals were less. In general, I never used to hear diabetes, BP, even in the university, like no, the
Yeah, yeah.
offices. Now every alternative person, if two professors are there, or any office also, two people, one might be sick or having low blood pressure or high BP.
Yeah.
Did you find that the occurrence of this two
Disease.
in your practice?
Definitely, we can say incidence of having hypertension, diabetes, heart attack
It is an
is
increasing trend
rising.
on,
It is
yeah,
rising,
raising.
and it is a disease of your lifestyle, basically. So, as you are having more stress, more worries, lifestyle is becoming more fast. You are, urbanization is rapid. Even rural people also they have changed their habits. People are now attracted towards all those.
Materialistic things also,
Yeah,
that is causing more
yeah.
stress.
As you said rightly, occurrence of diseases like hypertension, diabetes, heart attack, all these things they have gone up gradually. And basic reason why these diseases are more prevalent and occurrence is going up and up, it is a lifestyle problem, and that's why that diseases are called as a lifestyle diseases. Stress is very important, and maybe it is a work stress or stress because of their economical earnings, and basically unrealistic,
Expectations about life.
expectations, and from student also, parents they expect that he should become a doctor, he should become a big engineer, so they put pressure on that child
They don't see the capacities,
capacity, and even children also they don't realize
the
what is their
process.
own,
Yeah.
yeah,
Do
capacity.
you think this
So
social media also adding up to that
social media is adding
more?
some of,
Do you see the present education system also is putting a lot of stress on students? Is it
uh,
that much required?
yeah, actually I can after having my kids, they
Yes,
have done
especially your both son and
uh,
daughter also in the
yeah,
same
they have
field.
become doctors,
When
not
you
only
did MD, MBBS, MD, and M, uh,
I have done my MD,
DM,
and then
DM,
yeah. So I have done my MD medicine at Aurangabad Government Medical College. So my son and my daughter, both of them, they are doing now after MD they are doing DM also. But definitely since their seventh or eighth
standard
standard,
onwards.
they are all the time stressed. They have to go on, reading books. They are constantly involved
But
in their
yours,
study.
daughter and son, I don't feel stressed. They're hardworking, but they
Yeah,
have potential. That is where they could excel.
yeah, yeah, yeah.
There are many students who did not crack the MD exams.
So that entrance examination itself, what I can say, level of that entrance examination is too high,
Too high,
too high.
too high. For that, they had to
So
literally work hard,
yeah,
and they must have high potential.
correct.
Like,
High,
what type of abilities you expect the students who want to go for MBBS, MD must have? If they don't have these basic capacities, it is very hard to for them to
so
get succeed.
actually, I believe in
Can you list out, like, because as a student and you have seen your daughter and son, what are the 10 capacities or the abilities or personality traits they
yeah,
must
yeah,
have?
yeah. Actually, the very basic thing is, I believe in born talent. That
Yes,
is one thing.
yes.
Another thing is your family environment.
Family environment. So one is a potential,
Yeah,
basic potential, family environment.
yeah.
Yes, even we do in counseling also. These two are
And
very important.
yeah, and now third thing, that student should have hard working
Yeah,
capacity.
willpower, willpower.
Willpower should be
Not
very
for
strong.
parents or anybody saying
Yeah,
their interest,
yeah, their own interest,
genuine interest.
their own. Uh, it is not like by force
Yes,
they are doing that thing.
they must have passion to do
Yeah,
whatever the
yeah.
education they are
And then
interested in.
after that comes very important thing, whatever motivation they get from teacher, then from
Teachers play an
parents,
important role.
then from society, and maybe nation is giving some motivation to them.
Yes, yes.
So definitely that motivation part
From
is
the
required.
schools, from the
Yeah,
family,
and maximum motivation I will say,
from
in
teachers.
my school days teachers were
Yeah,
excellently
because we
giving
used to
that part.
consider teachers next to God only, like
Yeah,
no, they know everything.
so teacher, if they motivate their students, even teacher they know potential of
Yes,
their
actually,
students,
yeah.
so they pick up few students,
And they're
and
writing,
then
guide
they
them.
guide them properly, having some, at least he should have some good healthy habits. So for that he need to give some time,
Some
at least
meditation,
10-15 minutes
meditation
meditation,
or
some
watching
sort of
TV, something.
exercise. They should have some extra knowledge also. So need not be.
Among the daughter and son who had this extracurricular activities interest,
Actually, Pranav is having that more extracurricular
what
activity.
does he go for outdoor
Uh,
games or something?
yeah, he is going for photography.
Okay,
Then
that's very good.
he loves, moving outside, going for some. tours, and actually my daughter is loving, going
Reading.
for a trek.
Okay, try.
So she loves nature.
But outdoor. That's a
Outdoor,
good.
outdoor,
That's a
yeah,
good hobby.
yeah. So apart from your studies, apart from your
So you want to
book
say
knowledge,
they must have a little bit general
yeah,
awareness about
yeah,
other professions.
yeah. They should have some social attitude. They should develop some kind of, like helping needy people, helping some students, or you can help some old age people. You can help maybe farmers.
Yes, yes.
So that kind of social activities from college days, you can get that sort of approach towards helping out needy people. In my college days, medical college, we have one organization, Hello organization. So they used to go to the village. They used to do some survey or a health survey of all those people. Then after enrolling all those village people, individual,
Intervention.
disease wise, they started, giving treatment. So child health, mother's health, like
Senior citizens.
yeah, senior citizens. So that sort of social activity
In the
also,
university, they have compulsory rural
yeah,
experience.
yeah,
They had to understand few families and they had to plan the intervention,
yeah,
then implement it, and they had to see the result also
yeah.
by
And
working.
just treating patient is not enough.
Yeah.
In medical field, prevention.
Yes, more
So that
important.
preventive work, whatever you have to do, it begins from your social activity.
Yes, yes.
So that's why that subject is also called as a preventive and social medicine,
Oh,
PSM.
yes. Very
That
good.
subject is there in our curriculum.
So now you are a pride father, pride parent, both of you, and as a parents, what are the five things you were very consistently followed in upbringing your children? Five.
Actually, since childhood, from both of us, one thing was there about doing hard work. Every time we used to say our children,
Work hard.
we have to work hard.
Was it
Uh,
discipline and this activity time management indirectly came with the hard work?
yeah, definitely from their school,
They had
from
routine schedule. That is
yeah,
a
routine
disciplined
schedule,
life.
discipline. Yeah, yeah,
What about healthcare? Because they both of them always I saw them
yeah.
whenever I meet them very healthy.
So we have to take care of their nutrition part. They should wake up at proper time. They should go for sleep at proper time. They should get proper sleep also. That every parent need to see regarding
That's
their
what you were
children.
mentioning. Even now,
Yeah,
also both of you go to early bed,
and
early to
early,
bed, early to raise.
early to rise. And my both daughter and son, they have developed that idea, and now when they are learning post graduation and super specialty, definitely that has helped in their upbringing. So that is another thing. You should have honesty. That is another
Honest.
issue. Like they should be honest in every field. They should honestly tell whatever they have done. Something mischievous thing they have done in their school life, or they do some quarrel with their friends. So honestly, they should come and they should talk with either mother or father, and they should accept whatever mistakes are there, or they should even by having some great success. Uh, Excitement is definitely there, but we used to control their excitements also.
But
That
you taught them being having humility.
yeah, so they are not like a pampered
Children.
students. Actually, what I will say, having respect with your teachers, seniors, parents. particularly teachers. That is becoming less nowadays. And
They're
my
becoming
son and daughter,
casual.
yeah, my son and daughter, I used to always tell them that you should respect your teachers. They are teaching you something.
Yes.
They are definitely greater than you at that particular time. Maybe when you become
Yes.
elder, and when you learn
Knowledgeable, more
more,
than more
you are,
qualified than
yeah, more
teachers.
qualified.
But
But
teacher is teacher.
teacher,
Same way
basically,
parents also.
yeah,
Whether they're less educated,
yeah.
whatever we are, we had great respect for parents.
So I'll give that example. Like my school teacher, first standard, second standard teacher, or up to 10th standard where I've learned. So those teachers, they come to me as a patient. But all the time, that respect is there in my mind. Whenever they enter in my clinic, I immediately stand
Yeah,
up.
yes.
So uh, definitely that teacher gradually they will say, "Arey Gopal, don't
Yeah,
do that
do
kind of
that.
thing. We are coming to you as a patient." But always I bow my head in front of them. I respect them. I will examine them properly and with respect. I will treat them. But that thing never goes from my mind.
Yes,
That you can say it happens naturally,
yes,
and it
yes.
should be.
It should
You
be.
should have
Yeah. It is
respect about
inbuilt
your,
in a good student.
yeah,
Nobody teaches them.
yeah,
Teachers never taught us to respect them.
because of your educational development. So gradually you become more
Yes,
educated, but the basic base,
yes,
of your thinking, your personality, your development is because of him.
yes.
So we
And
should
when
always,
we respect our teachers, also the joy we get is unparalleled.
yeah, and I believe in that also, that always there is a meaning for something, like blessing from your
Well
teacher.
wishes. Yeah,
Yeah,
well wishes.
so they bless by their heart,
Yes,
and that blessing will definitely take you,
yes, to the higher,
yeah, to the
higher side of success.
yeah. Practicing as a doctor, basically you are a doctor. You are taking care of a sick person, and there should be some emotional connect also. On one hand, it is said while treating critically in patients, you should not be emotional, too emotional, because that will trouble your own mind, your own health. But I feel that emotional connect should be there, and with that, you will be able to treat that person properly. Then upgrading your knowledge, because medical science is always
Everything
changing.
now,
Yeah,
everything.
whatever concepts are there today, maybe tomorrow exactly opposite thing will come in reality.
Yes, yes.
So you should upgrade your knowledge, and it is an application of your knowledge to your patient. Then always, while taking care of patient, you should have some preventive thought in your mind. So you should educate them
Yes.
all the time, giving them some health education tips. It will educate patient also, and relatives coming to with that patient.
Yes.
They will also get educated, and some preventive activity they should be able to do.
Simultaneously
Yeah,
should be.
yeah. Then, while treating your patient, definitely you should think about their economical status. Uh, Always try to give them,
Multiple options.
yeah, multiple options. Nowadays, some people they opt to go for government schemes, and rather than taking very high cost treatment
So
in
now
private
doctors
hospital.
also have to upgrade about what are the government policies and
Yeah,
programs.
yeah, yeah.
Mhm.
That is also there. Even some charitable hospitals are there. You should know about them.
Referral service.
Referral
Doctors should
service.
give
So
referral
all the
service.
time, doctor should put multiple options in front of them,
Yes,
and
yes. Whatever they can
properly,
afford.
yeah, properly refer to that patient. Young generation, definitely they have to do hard work also. Lot of we can say competition is there all the time, but in medical field it should be a healthy competition, and one should by priority you should treat your patient honestly, not with any intention to earn more money, and not with any other bad commercial intention. Definitely, number of patients are too much
Yes,
than
yes.
your
In every
expectation.
field,
Yeah, you have.
there is no dearth of waiting for the patients.
Yeah,
Sometimes the doctors only say that we don't want to treat the patients in more number because
yeah,
we
yeah,
don't
yeah.
have time even to rest and have food.
Correct,
That's
correct.
what
They don't
sometimes.
have their own personal
Yeah,
life,
right.
but number of patients, number of diseases, treatment options, day by day they are increasing, but still the disease burden, so patient burden is not coming down. So everybody has got work. So as you work, definitely you are going to have money accordingly. So with that commercial intention, you should not, or you need not work also. Automatically, you will get work as well as you will get money, you will
Yes,
get name, you will get good, internal feeling.
yes, yes. That is more important.
Yeah.
Satisfaction. Thank you, doctor. Thank you so much.
Thank you.